Welcome to Mindset U Podcast, your source of mindset education. We aim to provide you with free, valuable education for you to thrive. Enjoy. This is part 1 of 4 with our guest Karen, an amazing person, therapist, and athlete who has dedicated her life to taking care of others. Listen to how she faces her biggest challenge yet. So today we have Karen with us, and our focus here is always on mindset. And Karen has shown amazing mindset in her life and the most recent things that she has experienced. So if you don't mind, Karen, tell us a little bit about yourself as a whole, like who you are, who is Karen, and how does that relate to your challenges and how you've overcome them.
So I went to college for 4 years. I had a degree in psychology. I worked for like a year, and then I realized that if I want to do anything more in mental health, I need more school. So I enrolled in a program, master's degree, to become a therapist. And I brought my perspective on mental health, my personal perspective, to my practice, and I always encouraged people, like, are you exercising? Do you move? What's your lifestyle like? Most people that came to an office for talk therapy just wanted to be passive and be healed by someone else. I didn't find that my own personal and professional recommendations for people to get moving was really being received very positively. Most people just, okay, yeah, I'll start walking, but the next week, oh no, I didn't, because something came up, and that was mostly what I encountered. So 10 years into my practice, I said, it's not really getting what I want in terms of helping people. Because my whole life has always been, I view myself as a helper. So I decided to get a certification as a personal trainer because I thought that would legitimize me. I would have more information. I could tell people, yes, I'm a therapist. I'm also a personal trainer. So I did that. I got a couple of certifications, and I learned more about it.
Can I ask you a quick question?
Yeah.
So you talked about wanting to go to school and getting your master's for therapy, but where did that desire come from? Like, why did you care for that? Why did you have an interest in helping?
I think that just speaks to the root of who I am, my personal values, my family of origin growing up. It was something that I did. I did that with grandparents. I was always looked upon to help, and I didn't mind it. Maybe in some ways it gave me an identity within my family, like, go to Karen, she'll help you. So I think I kind of came to that really early in my life, and it just seemed like a part of my core.
So I got one question. Is you had mentioned something in your story where you were working out, you were active, but it was hard to be consistent. And then one day you kind of just made the decision to be consistent because you kind of realized the connection between mind and body. What was the driver behind like that commitment? Like, what was the thing that made you in that moment say, you know what, like, this is a non-negotiable?
I love that term because that is exactly how I would phrase it. It became a non-negotiable when I recognized that I just needed this for well-being, for overall functioning, for getting through my life. Medication addressed certain issues, but I didn't feel well. I felt less sad, but I didn't feel well. And then when I started to get really consistent with I'll say exercise, not workout, I just felt like myself, and like that was really the defining moment.
So why, like, in the therapy world, right? Like, as you said, you try to put this into your practice.
Yes.
And I know because I've been to therapists as well. Why is it that in the therapy world, it's compartmentalized as like this one kind of exercise, and this is your body and this is your mind? Why isn't there kind of a practice in the education or training of therapists and psychologists of like, hey, exercise is like
Medicine.
it's a medicine, it's a prescription?
If I had that answer, I would tell you. Only thing I can use as a reference point is that I think everything in our healthcare system is very compartmentalized. So if you have stomach issues, there's a really good chance that it's somehow connected to your emotional health. But you go to a gastroenterologist, they're going to do colonoscopy, endoscopy. They're going to do all their diagnostics, and they're most likely not going to say, let's talk about how your mental health is affecting your stomach. So that's my answer, that it's very compartmentalized, that patients or consumers or clients, what terms are interchangeable, don't always know enough, and they are, I said, like passive recipients. The doctor said, do this, okay. Doctor said, take this medicine, okay. If the doctor said, here's your prescription, get on a walking program and start moving your body 5 days a week and come back in 3 months and let's reevaluate, maybe that might be viewed as something that the person would do, but I'm not sure.
No, so Karen, you have this perspective that's different from your colleagues, right? You're trying to impact people's lives through therapy, and you recognize that there's more needed. What I got from what you said before is like you can recognize that the fitness, the exercise aspect from your own experience is a very valuable, non-negotiable aspect of your mental health. Right? So you're practicing this, you get your certification, you're recommending people to exercise. What happens next? Like, what are you able to do with that, if anything?
Not nearly as effective or helpful as I hoped it would be.
Why was that?
I think because of the same kind of answer that I gave to Mo, that people are going to a shrink or some other, medical office, and they want to be told, like, take this pill, come back in a month, let's do a test, let's check your blood. I think people don't really embrace it in the way that, I went to a therapist and she said start exercising or become more active and less sedentary. It's just not viewed as a priority, and I think there's a lot of resistance. People just want it to be done to them or for them. They don't necessarily feel the drive or the importance of it. So, and on a professional level, I think people in my colleagues sometimes are not that aware, self-aware in their own lives, and they don't really value it in the same way. So I have tried in numerous places to implement just like an overall well-being program, which would incorporate mental health, talking to somebody, but also there's the room down the hall where you can actually do 20 minutes of moving your body kind of a thing. And I've tried it in different locations, and it's just not been successful.
So do you think, like, because what I heard was you said you were clinically depressed for X amount of years. They gave you medication. You then started training, working out, exercising. And then, so my question is, do you feel like a lot of people don't take that step because they're not aware of the pain? So they like come to therapy to kind of avoid pain or avoid the kind of discomfort, versus like when you exercise, there is a part of it, like you're kind of associating yourself with pain and discomfort and exercising. And I feel like for you, at least what I'm hearing is that, that depression was the pain that you were trying to solve. And instead of running away from it, you kind of started to dive into it. And there was like this philosophy of like associating yourself with pain through exercise.
You're making me think, which is good. And I guess I'm going to kind of loop it back into the self-concept of recognizing really early in my life that I just felt better when I moved. I don't think I was a depressed kid, but it gave me like life energy, life force. And so I think what you're saying, I think is really on target about people not facing their pain or not acknowledging it and tolerating a kind of mental pain, and almost becoming immune to or having an expectation that that can't get better. And I think for me, I was able to kind of shift gears and delve into the physical world, because the so-called pain that I encountered there actually regenerated parts of me and allowed me to just feel better overall. Mental clarity, physical benefits, obviously, but I think that's a really good point.
The reason I say is because like when I hear people talk about exercising and how it helps them go through these mental kind of anxieties or health issues, I think of the quote by Lucius Seneca. I mean, we treat the body rigorously so it will not be disobedient to the mind. Mm-hmm. And to me, that's like, hearing your stories, like the quote that popped up in my head. It's like, I'm not going to let my mind, my emotions dictate my thoughts and my actions and my behaviors. And like exercise is that training of that.
I have a question to like follow up or correlated to what Moses asked from the patient side, right? You talked about like trying to implement these formats in different places, but I have a question regarding the way people show up. Do you feel or see that people show up just like, hey, I'm here for you to fix me so I can get back on my way? Or is it like, from the patient standpoint, are they taking an involvement into their health, their mental health in that state? And if they are, where do you see that for them creates a separation to that physical health?
I think it's not a unilateral, everyone does this, everyone does that. But I would say from more than half of the people that I've ever worked with, and that's a pretty big number, it's mostly people that don't really want to kind of like take charge and feel like they have some control over their overall well-being. It's definitely more of a fix me. Mm-hmm. Tell me, give me the answers. Tell me what I need to do or not do. But if it requires something that I have to actively put out energy for, I might not want to do it, kind of a thing. So I would say definitely the majority of people that I've worked with are more in the category of just fix it and tell me what to do. And they don't take responsibility for their own day-to-day life. I mean, if you go to a therapy session, it's probably less than an hour out of your week. And then what about the rest of your days, hours and days? So it's not enough unless somebody's really going to implement some sort of, I give people homework. Like, this week you're going to try this, okay? Yes, no, maybe. Some people do it. and a lot of people do not.
So to kind of segue into or back into your story, recently you've been on the other receiving end of that kind of interaction. So I'd like to know, first of all, I'd like you to share with the audience kind of your experience, your story here, but also in terms of what you were just saying, like the impact of like that, taking that responsibility to make that change. Like, how does that play a role in your own healing?
So my physical pursuits have been varied, and over the past more than 10 years, I've been really passionate about road cycling, and started out not knowing really much other than, like, I learned to ride a bike as a kid, but it resonated with me for many reasons, including the pain factor, because you get a benefit from putting yourself through tough things. So people think, oh, riding a bicycle, you just pedal, but there's a lot more to it. Anyway, I've been a road cyclist for probably seriously for about 9 years. Prior to that, I just kind of pedaled around. But last July, I was hit by a car, and coming back from a bike ride, I was finishing a 30-mile loop in the morning before work, having a great day until that moment, and I was very critically and seriously injured. My spine was shattered. I had a very serious concussion. I broke my pelvis, my tailbone, internal bleeding. It was a very serious accident, and I required a neurosurgeon to fortunately be able to put my spine back together. One of my vertebrae burst, which was very possibly going to leave me paralyzed, but that did not happen, fortunately. I have metal rods down my back for the rest of my life, but I am here, I'm functional. If you see me, just the visual, you probably can't tell anything happened to me, but something big did happen.
What does your health, love life, spirituality, career, finances all have in common? Your mindset. Mindset is the source of creating change. To learn how to install these and other life-transforming concepts, browse through our free collection of courses at betheproject.com.